really can't dress themselves. They really can't get out of bed themselves without some significant assistance. Then people would look into a home health aide, and they have more specialized training. They know how to transfer people from bed to wheelchair more safely or get them back into bed. They have more training around helping with personal care. They can help manage if somebody has sort of a complex diet because of a health condition. They can help figure that out. It's more hands-on, and they can help with, reminding of medication. And then with people that have more medical needs, more focused medical needs, and just not assistance, I mean, there's sort of a variety of resources there. There's a visiting nurse that can come either through a visiting nurse agency or private nurse agencies. There's physician and nurse practitioner practices that are set up right now that can go out and provide primary care to people in their homes if they can't get out to the primary care practice. And again, they provide much more extensive care. And in addition, there's, I would say, in that category is your physical therapist, your speech therapist, your occupational therapist. So it's more medically focused care. And I would say, these days with technology, there's many new technologies out there that monitor people's vital signs from home. You can actually interact with sort of a doctor via Zoom or via many other platforms that you don't even have to get out of the house or have someone come. Sometimes you can do it virtually or remotely. So there's that type of technology. There's that type of monitoring type systems to monitor vital signs, monitor breathing, many things like that. I think a lot of people are familiar with monitoring in terms of personal emergency response system, like your Lifeline or your alert button, where if you fall or need something, you press the button and somebody comes over the telephone or sometimes the computer to ask if you need assistance. But there's many new technologies out there. And I would say something, it's sort of monitoring, but there's such an availability of different cameras to monitor people in their homes. And frankly, some people find that comforting, that and some people find it quite that it impacts their privacy. I'll be honest. I have an aunt over in Arlington, Massachusetts, and I had trouble getting her caregivers during COVID, and I bought a couple of sort of mini cameras that I can see what she's doing on her phone, and she didn't want anything to do with that. She's like, this is my house and my privacy, so it doesn't work for me. But she's had a few falls. But she said, when she is really scared of being alone and wants to be able for me to see her quickly, then she'll be open to that. So it's a process. Whatever type of care, it's a process.
Debbie, what do you think about, and this could be very pricey, but some people have the iWatch. If they have the iPhone, then they have the iWatch that can monitor their heart rates and their steps and activities. Yeah. But that is very pricey. What are some alternatives if people don't like, and like you said, there are many different types of devices, wearable devices that people can wear, but what are some that are easy on the budget and doesn't seem like doesn't look like you're letting people know that you are this person who can fall at any time?
Mm-hmm. Yeah, so that's a good question. I don't know the specific price of one, but certainly the iWatch is one, and companies are actually sprouting up every day with a variety of technologies that that can be helpful. There's one company that's sort of getting started around monitoring if people tend to change their gait or their stride or seem off balance. A sensor can go off that they may have an impending fall. So that's just one. But I would urge people to sort of talk to their healthcare provider to see what their needs are. But the good news is, with the aging of the population, with so many people, especially now, wanting to stay at home, and home is where the heart is, you are going to see all kinds of technologies, and the prices are going to come right down, because there'll be competition, and there really is such a need. But whatever technology, just be careful if you make a real long-term commitment. If certain technologies you're interested in, you want a 2 or 3 year commitment. Actually, in cell phones right now, you sort of make a 2-year commitment. So just be careful of that, because again, your needs may change. You may, in 6 months, move in with a family member and won't need that type of thing, or something like that. So you don't want to get stuck in a long-term commitment if it looks like your needs may change. And new technology comes and you might find something different.
That's a very good, very, very good point. I never even could have, thought of that. Some people I know, when I was doing a falls prevention program at one of the local community centers, one of the members who attended the program said she has an Alexa, and she has an Alexa in every room. She has it in every room just in case she falls, and she's programmed Alexa to see, Alexa can't call 911, but it can call one of your contact lists. So you can designate who Alexa would call for you. So that way that person can then call for help for you. But I thought that was brilliant to have an Alexa in every room.
Right. Yep. And that's a great idea. And the other option for people that can't have an Alexa in every room is, again, a personal emergency response button that you wear on your arm or wear around your neck and press it. And actually, and with those type of ones, you can even be outside. So if you're walking in the garden, if you're walking outside, it covers a number of feet. But again, you're right. There's just so many different technologies and options, and even stores are getting into this business where Best Buy recently, I think, purchased a company or is going into the business of home monitoring and home care.
Yeah, and if people don't have the means to afford these medical gadgets, I also read somewhere that in certain communities, especially if the community is very tight knit, they could have the system where a senior, if they're feeling okay, they would put like a certain colored paper on their window. Or if they needed help, a different color paper on the window, just to kind of designate that there is a need or that person is okay in there. But of course, that requires some sort of an understanding amongst the neighbors. But at least it's a non-techie way to communicate that the person who lives in there by yourself maybe is doing okay, or maybe has an ask of somebody.
That's a great idea, and that's wonderful. I haven't heard that, because the benefit of that is, if it's just not one neighbor looking out, it could be a neighbor a few houses down the road who's seeing, Mrs. Jones has a red piece of paper in her window. That means she has a need or an ask. And Debbie, you and I have talked in the past that there's called blue zones across different parts of the world where people live into their, 100s. And in one of those particular areas, a small village, I think it might have been in Hawaii, but I can't remember. But what they do is they have a small village, and every morning, people open their door. And if your door isn't open in the morning, then your neighbor knows something's wrong. So what you mentioned is along those same lines.
Mhm. Yeah, community, yeah, taking care of each other and making sure that everybody's, it's just, yeah, it's a way, the Blue Zone, as you mentioned, it's like a community of people who believes in taking care of themselves, social interaction, meaningful interaction, and also activities. And these particular communities, the Blue Zone, they also have a strong faith-based, right? They have a strong connection to faith, so that they're all in this common understanding of having a well-balanced life.
Exactly. Yep. Their diet, having social interaction that really is balanced around health, around spirituality, around medical issues, and companionship and socialization.
Yeah.
And I would add that out of all those factors, what helps the most is connection.
Yes, yes, yes. And that has been proven in many different studies that in order for people to live a long quality life, a deep relationship, social interaction with, doesn't have to be family. It could be just, a friend or, somebody that you have a connection with. It just really does help, because we're human beings. We're meant to socialize and connect with others.
You're exactly right. And I know many years ago, there was a study in Boston, and I don't remember the name of the study, so forgive me. But basically, they looked at a group of men in one of the Boston neighborhoods, and I believe they compared them to a group of Harvard graduates. And Debbie, it sounds like you know the study. And,
Yeah.
and they looked at them over time, and they interviewed them intermittently throughout their years. And I believe the result was, it didn't matter socioeconomic status. It didn't matter education, whether they went to Harvard or they were working class individuals in the Boston neighborhood. It didn't matter. What they thought about happiness and success was all about that connection. And I would ask you if you have anything to add on that, because I don't remember.
Yeah, actually, yeah, it's a 70-year-long study. So can you imagine a study taking 70 years, 70 years? So you have a change of guard every few years, right? To make sure that the study stays legit. So it's a longitudinal study, and it's a grant study. And they have also, there's a book on that. And it does it. They just kind of filtered it down. What are the secrets of these people? No matter if you are a Harvard grad or not, what are the secrets of these people to help them live a long life? And that is deep, meaningful connection. Yeah.
Yeah.
Yeah. So, how can we borrow from that living? We may not live in the Blue Zone, and we live in our own little communities, our little condos, apartments, little house, and we may not know our neighbors, but how can we do that? And one way is connecting this way through Zoom and being a part of libraries and, community centers, to be able to continue the connection somehow.
No, I agree. And, I don't think we realize sometimes how lucky we are that we live in Massachusetts. Massachusetts has an abundance of resources, and I'll share just a few at the end, but an abundance of resources and infrastructure to help people age successfully and age at home. And some of those things are, like healthy cities, designing cities and towns to make it accessible for people that are not only aging, but people with disabilities to be able to get around.
Yeah.
In addition, on the mass.gov website, just a lot of information, again, from home modifications to explaining about different services at home. And then throughout the state, a solid structure of organizations that are senior focused. They're called Aging Services, ASAPs, Aging Services providers, and they cover different towns. And Quincy is followed by South Shore Elder Services that not only coordinates services for people, but provides education around it, provides some case management, and is a very strong resource to help people age at home and age successfully.
This is great.
Yeah. So a few other things I wanted to touch on next is caregivers. And, you know, caregiving, whether we are caring for a loved one or another caregiver, it's really key and important to, you know, really appreciate caregivers. It's really hard work. It's grossly underpaid. And again, with COVID, you know, a lot of women have been displaced out of the workforce because they had to do full-time caregiving, whether it's aging parents, aging relatives, or caregiving children. So it's important to figure out what caregivers need and how we can help them, even if the caregiver is taking care of us. I think empathy, I think respect, figuring out what their needs are. Because again, it's very difficult and challenging work. And many caregivers, especially I think caregivers that work for agencies that aren't affiliated or part of a family, I think they need special care. Because again, the pay isn't great. It's hard work, and it's very respectful and so important work. So I think whether you have a caregiver or you're a caregiver yourself, I think, you know, it's important, you know, to find out, you know, what the caregiver's needs are and you as the person that are getting care, what your needs are, and to have an open, honest dialogue around what's working and what isn't working. And try to, it's a relationship. You have to cultivate it. You know, I'll give a brief example. Last summer, I read in the Boston Globe that in Maine, there are a shortage of caregivers. I'm not sure if that's the truth now, but Maine was in crisis last year because of a lack of caregivers. They didn't have enough. You couldn't find a paid caregiver. And people had to leave their jobs to pay for it. It was a crisis. And that's true in other places as well, but it was highlighted in this article in Maine. And people had to sort of leave their jobs to take care of their relatives because you couldn't find a caregiver. They just weren't available, even paid caregivers. So I say that because I think, you know, finding good caregivers is precious and it's a gift and it's hard work. And again, also helping, you know, figuring out what the caregiver needs and helping them sort of either manage stress or, you know, have them get connected with caregiver support groups, just to know that they're not alone. You know, I think that we sometimes forget that, you know, caregiving for an older person is different than caregiving for kids or babies or little kids, sort of in the daycare situation. In some way, both groups have distinct different needs, wants, desires. needs for modes of communication. I mean, younger kids are sort of, resilient, and sometimes you sort of give them a cookie and they're fine for a few minutes, or put them in front of the TV. People that, the aging population, they have different needs. Sometimes they need lots of interaction. They need support with their ADLs. They're struggling with the loss of feeling independent and the ability to do things on their own, and loss of friends and family, and that's not a totality, but some people struggle with that, and then caregiving, having to deal with a caregiver sometimes can be a challenge. So the key is, if someone's caregiving for you, to sort of try to communicate what your needs are clearly and figure out what their needs are and how to support them. Because again, it's really a relationship.
Debbie, there's a question. Would you recommend any level of particular care based on any particular benchmarks?
Any particular, in terms of benchmarks, level of care, I think that's a good question. It's a challenging question. I think for caring for some, I think there's benchmarks for caring for people in skilled nursing facilities or in hospitals and things like that. I think people that are in their homes, it really kind of depends on their needs and what their wants are. So it's sort of a hard question to answer for people that are home, but I think it depends on their needs and their wants, and the help they're willing to take and the help that they're not willing to take.
Yeah, I think it's a great question. And also, like you said, there's really no, it's not a yes, no question. Because caregiving is it falls on a spectrum. I was just emailing my dad's PCP this morning. And I was saying to him that, I'm trying to, coordinate his appointments, my mother's appointments, and also my work. And I said, such is the life of being in a sandwich generation. So sandwich generation, I have my kids. So there's a caregiving spectrum, being a mom, and then being a daughter of aging parents. And also I see it in my mom, because she's the caregiver between my mom and dad. So there's that, and it becomes almost like it just seems like it just happened overnight that my mom suddenly is taking care of my dad, but they have been going through different movements or understanding between them that, she'll start doing this more and he'll just follow the lead. So it's not that one day that, okay, I'll be your caregiver. It just kind of happens gradually. So a benchmark that might be difficult to delineate, but what's important is to know what's available when you do start needing extra services, so that it doesn't become like a shock for you, the caregiver, or the person that you love, that, oh my gosh, I need this, now what? It's always good to be in the know, so that way you could pick and choose and have nice discussions with other people who might be using similar services and what their feedbacks are or comments.
No, I think it's a great question, and Debbie, your what you talked about with your folks is really a great example. In that, people's needs do change, and sometimes quite subtly. Sometimes it's quite dramatic. For example, I used to be a nurse practitioner in different skilled nursing facilities and rehabs, and the majority of patient families I worked with say to me, my dad did fine at home, but when he went into the hospital, all this happened. Or when he came to this rehab, all this happened. Well, I heard that more often than not. And what we see and realize is people sometimes, they compensate at home and they do okay. They're hanging in there. They're doing their thing. They're doing their thing. And it just needs an event to sort of tip them over, whether it's getting the flu or a fall, anything like that. It's just enough to tip them over because they're able to hang in there. They're able to compensate and do their thing. And then an event happens that changes everything. I think what you talked about with your parents is important. And I would say to the audience as well, it's so important to communicate and have a plan with family around, okay, you two are doing okay at home now, but what if A changes? What if dad needs more? What are we going to do? What if mom needs more help? What if you can't live here? Having a plan. And again, it doesn't have to be etched in stone, but I think it gives people peace. Not only the aging parent, but the rest of the family. It gives peace that, okay, yes, they want to stay home, but if A and B happens, that's not possible, and they're willing to do this. Because 99% of the time with the aging population is we react to a crisis. We're in crisis mode.
Mm-hmm.
So it's so important to have those conversations upstream about if somebody needs more help, what's the plan? If somebody gets sicker, what's the plan? And, very important and key conversations around advanced directives and healthcare proxies. And if something did happen, what kind of aggressive care does somebody want or not? For a 95-year-old that may have a cancer, is aggressive chemotherapy and radiation the right thing? Or does the person feel like, no, I don't have that much mobility and I probably wouldn't do well. So conversations about what people want, what people desire, and to look at it as nurses holistically, from not just medically, but social, but spiritually. And really, it's a system. How does it impact the rest of the family? So it really is important to plan and have tough conversations. And those conversations are difficult to have when people are healthy or relatively healthy, because that's the time that they don't want to talk about. Like, I'm not there yet. My aunt would say to me, I'm not there yet. I don't want to talk about this. But something, here's the choice. We talk about it now, we plan now, or I'll be in the hallway, in the emergency room, and the doctor will say, well, do you want us to save her? Do you want us to do this? That's horrible, because you don't have time to think, don't know what people's wishes are. So I really, and it's a great point, Debbie, that really conversations about planning ahead and really planning for lots of different things. Some scenarios will come true and some won't, but it's better than waiting for a crisis and then trying to figure out,
Exactly. It's like the elephant in the room, right? So you're trying to pretend it's not there, but the elephant is there. So, having these tough conversations is tough. It puts lump in your throat. There's going to be tears. There's going to be hopefully hugging and, deepening of relationships. And if the aging adult is lucky enough to have people in their life to have these tough conversations with, that's great. And if they don't, it's good to know that there are people, the Commonwealth Care Alliance, who are there to help them age well at home. Right?
Yeah. So Commonwealth Care Alliance, thank you for mentioning us. We are a special needs health plan, and we enroll people over 65 as well as people 21 to 64 who have Medicare and Medicaid. We call them dually eligible. And yes, we have a strong mission for many years now to do what we can to provide not only primary care for people at home, but coordinate all the services they need, from from home modifications to care management to home health aides to Meals on Wheels, to DME, and we have nurses and nurse practitioners and behavioral health staff. So we have the whole continuum of care, and we try to provide care to keep people at home when all possible, and actually support caregivers as well, because again, it's not easy.
Yeah, that's great. What type of supports are available out there for caregivers? Caregivers who are caring for their spouse, or maybe their sibling and they're aging. So what are some really ones that stands out for you? And where can people find out more information about that?
Sure. So actually, there's a ton of information on the internet. So whoever you're caring for, you could sort of Google that, like caring for sort of a disabled child or caring for parents. There's a ton of information that you'll find on the just by Googling that. And then if you Google sort of caregivers in Massachusetts, you'll find more local information. And again, South Shore Elder Services has a lot of information on caregiving. And you know what I think is the most helpful, and maybe it might not be for everybody, but for me many years ago when I had a close family member pass away, I attended a caregiver support group. It happened to be in a local church. And I know with COVID, that's not happening as much. But what has sprouted up, thankfully, is caregiver support groups that are on Zoom and virtual. So those can be found at the internet as well. And I think that's particularly helpful because the big thing is, you're not alone. And other people are on there struggling with their aging parents or an aging sibling. So you're not alone. Provide support, provide ideas. Other recommendations for caregivers is really, you have to take care of yourself. You have to sort of sometimes set some boundaries. Self-care has to come first. And, we see all the time, and Debbie, you as a nurse, we see all the time that what happens is, a couple is caring for one another, and the one that's doing the caregiving of the person who's sick, the one who's caregiving sometimes dies first, because one, they don't take care of themselves. They neglect their own health. They're running on empty. They don't have a social support system, and they're giving everything they have to care for this other person. It's out of love, but I say it's like being on a plane, and unfortunately the plane might be going down. And yes, you can put your oxygen on somebody else, but then you can't help anybody else. So caregiving is the same thing. It's hard work, and you have to take care of yourself.
Definitely. It's that's where compassion fatigue falls into.
Exactly.
Right? Yeah, because compassion fatigue is just, you're just always giving. And also there's that element of doing it maybe out of love, out of duty. And then there's periods where you feel resentful, guilty, shameful, selfish, all these like complex feelings that you're battling within yourself, because you're the only person that can take care of this, person. You're the person that you're in charge of. So self-compassion, self-care, being kind to yourself. If you have to have a sitter or somebody to stay with your loved one for a night, please take advantage of that and try to create like a routine for yourself, so you're serving your needs and giving yourself a sense of joy, because you're a person that deserves care also, and the best person that can give yourself the care is you, because you know what you want. Don't feel guilty about having fun and experiencing joy and happiness.
You bring up a key word, and thank you for that. It's sort of guilty or guilt. And so many caregivers are plagued by that they're worn out, they're tired, but they can't let go. And, you know, it takes a village. And then, sometimes you just have to let go. And for example, if you have the opportunity for the older adult to go to an adult day health program, even a few days a week, you can't feel guilty about that. It gives them, they might not like it. I mean, everything takes time to get used to. We all have to, make adjustments, but it gives that person the ability to, be social with other people and have some structure. And some adult day health provide some level of nursing care or give medications.
Mm-hmm.
So they might not like it or because it's new or different, but it can have benefits and it can give you a break.
Mm-hmm. Yeah.
And so, I say, look, with sort of geriatric care and taking care of older people, it sort of takes a village. It's next to impossible to do it alone. It takes a village. And the more you can fill yourself up with energy, um, and self-care, the more you'll have to give. You can't, if you're empty, you have nothing to give. So you have to find ways to fill up in order to give.
Yeah. Thank you. Great.
Yeah. So I'll just talk a little bit. I sort of touched upon it. Again, very fortunate, I think, that we live in Massachusetts, wide-ranging type of elder services. This 1-800-AGE-INFO, if you have family members in different parts of the state, it connects you with Massachusetts aging service access points all over Massachusetts and what services are available. So that's a wonderful resource, especially, again, if you have elderly relatives in a different part of the state where you're not living and you're not sure what the resources are. And in addition, if you're thinking of moving or moving relatives to a different part of the state, you can see what's available. And then again, in the local area, South Shore Elder Services is part of the statewide network of agencies that are available to help point you to services, help coordinate services, and answer really. They're aging experts, actually, and we have aging experts in every part of the state, so we're fortunate with that. But they know what's out there, and they're good at assessing somebody's needs. And again, as people age and change, their needs do change. So there needs to be sort of some flexibility and planning ahead. And if people have resources, there's private geriatric case managers that do all of this coordination for you. But many of the ASAP agencies do that as well. It just depends on what people's desires or needs are. And I would say that, it's just important to sort of communicate. People can live at home with dignity, and have a good quality of life. It takes some work, it takes some planning, it takes honesty, communication, respecting needs and wants. Some technologies, and we're lucky to have those these days. So it can be doable for most people.
Great. I want to ask the people who are here during this Zoom presentation, if you have any questions, feel free to unmute yourself or type it in the text. In the meantime, as usual, I have questions. I always have questions. So Debbie, now that more and more people are getting vaccinated, what do you anticipate is going to happen as the world starts opening up, especially for the the aging population?
So that's an excellent question, and it's frankly something I'm quite concerned about as a clinician and a nurse practitioner. Because what I see turning on the TV is people, gathering. Things are going on in Miami with the spring breakers, and I was one of those spring breakers. I won't say how many years ago, but so I'm concerned about gatherings, people, not vaccinated, people not wearing masks. Because I also listen quite closely to Dr. Fauci, to the CDC, to the new CDC director, the physician from Boston here. That's now Dr. Walensky, now ahead of the CDC. I to them, and I hear their grave concerns. We have variants. I don't know the extent they're in Boston, but I would recommend the same things we've been doing before: masks, social distancing, getting vaccinated. I think it's a little too early to sort of let our guard down. So I think we still need to be careful. And especially, I think for the aging population, I was so pleased that they were so high on the list for getting vaccinated, especially people in homes and facilities. But I still think, we have a long way to go. I think there's light at the end of the tunnel. We're not quite there yet. So I would say continue caution for distancing, masks, and being careful.
Right, right. But still being able to take advantage of the nice weather and yeah. So
Absolutely. Getting out, getting fresh air, getting vitamin D, a little bit of sun, a little exercise, breathing the fresh air. Oh, I think that's key. That nourishes not only our bodies, but our souls.
Definitely. And it's almost like timely that, the weather, the nicer weather, I don't want to jinx us. It's been beautiful. I don't want to jinx us, but, and the COVID vaccine rolling out more and more to a greater population that people can start going outside. But just, keeping the basic hygiene in mind and social distancing, right? Washing the hands and just kind of, making sure that everybody is safe. Can you speak a little bit about you're a nurse practitioner, and you specialize in gerontology. I know I asked you this before, but for those people who are watching this, can you just speak a little bit about that, and how is a nurse practitioner who specializes in gerontology different from a nurse practitioner that you would see maybe in a minute clinic or in your doctor's office?
Sure, great. Yeah. So yeah, I'm medically trained as a geriatric nurse practitioner. So in terms of have the ability to treat people medically, write prescriptions, give physical exams, and things like that. I try to bring an additional view to my work as a gerontologist, in that look at people holistically. So in my mind, treating and diagnosing medical issues and conditions in people is very important. But I also bring the view of a person's, spirituality, a person's, what their social condition is like, what their home life is like, what they did, what their life was like when they were younger. What did they do for work? Really looking at the fabric of their lives and what makes them do, or what their situation is, to look at holistically. And all that information brings a lot of understanding to the whole person, to not only their medical conditions, but what's important in life. Because we do find that, the most important thing is to discern from people what really matters, what's important to them. For example, if I have a patient that, may opt for a really difficult surgery that they may not do well, I want to discern from them first, what's most important in your life? What is most And if it's, walking around the block with the grandchildren, or staying alive until someone's graduation in May, I'm going to take that into consideration on approaching the conversation with someone, to really discern what's important, because it might not be in their best interest to get them to see their grandchild graduate in May if they undergo this significant surgery that may be able to be delayed, or may opt to not do it at all, may manage somebody medically. So I try to sort of look at the whole person and consider, what matters to them. And also, I worked for a geriatrician many years ago, and he taught me a valuable lesson. It was over at actually Boston Medical Center. Gary Brandeis, who's a doc in New York now, he said to me, and I trained under him, and he said to me, Debbie, he said, you remember when you treat patients, you're treating their families. And and many times families and the patient want two different things. But if you take both of those into consideration and try to sort of meet at the middle ground, I think it provides better care and outcomes for people.
Yeah, boy, you really shared a lot and made me realize, when I was doing, when I used to work as a bedside nurse, I've had patients where one person comes to mind. He came in with pneumonia, lives alone, but has a cat. And, the doctors wanted her to stay and complete her antibiotic treatments because she was really, having a hard time, but she wanted to be released because, she needed to take care of her cat. Her cat was very important to her. And so we had to accommodate her, what she wanted, so that, we had to think about her family, which was her cat, and also her needs. So she ended up being discharged with visiting nurses and, IV antibiotics. And she was able to feel heard and witnessed. And so that, she got hopefully the best of both worlds. But yeah, it's so important. And I'm not sure if it's just a nursing practice or a way of really viewing the patient as a whole. But, it's very important. If anybody out there can, connect with a nurse practitioner in your doctor's office or have a nursing perspective in the type of care you're receiving, it's important because, again, we look at the whole picture of how the person used to be and the person in front of us, and also the person at home once they're recovering or maybe in the rehab.
No, I think you're right. Yeah. And I would say, in addition to nurses, we have those unique opportunities, but also I've worked and learned so much from social workers and behavioral health clinicians. And I would say, as I said earlier, that it takes a village, and at CCA and especially we work in a multidisciplinary team. The different disciplines sort of get together and sort of problem solve and try to figure out what's best for our members. So many practices can do that as well.
Definitely. Is there, we have a couple of minutes left. So do you have any recommendation? Is there like one or two tips for us to really kind of take away from this particular presentation, which was really great, by the way. Thank you so much, Debbie, for spending this time with us and really sharing with us ways that we could age better, age well at home. But is there one or two tips for all of us who are aging, whether caregivers or not? What can you share with us to kind of take away from?
So I think the two most things, and it's a wonderful question. In my mind, really, it's one, initially sitting down with our loved ones and sort of saying, if you get sick, who do you want to care for you? Do you stay here? Do you want to go somewhere else? What will that look like? You know, will you accept services enough? So just have a conversation about a lot of what ifs and just sort of write those out so you'll be prepared. I think that's key. I think understanding people's desires around advanced direct, what kind of care, aggressive care or not they need. And I think the third point really is for the rest of us to listen so carefully with what our loved ones, what their needs are and what their desires are. And try to sort of not only listen, but sort of take that to heart. You know, I think some that raise children, it's easy to say to the kids like, well, I want you to go do that. And, you know, you're under 18, so we want you to go do that. But for the older population, you know, we really have to take into consideration what their needs and wants and desires are. And it's a conversation. And I guess the last point is, again, you know, caregivers, they are just so precious and so important in caring for people.
Yeah. Great. Thank you so much. Again, thank you, Debbie Sylvester, for being here with us, talking about how we can all age well at home. And I want to thank you all for being a part of this program today, joining us. This is the Falls Prevention and Stress Management Program. And my name is Debbie Lyn Toomey, Tufts Medical Center's Injury Prevention Coordinator. And I hope you all join us again next month. I have great speakers who are going to be joining us, one on April 13th and the other one on April 27th. So thank you all very, very much. And I hope you enjoy your spring. Great day today. If you can, be out there. Of course, wear your mask, but definitely get out there and do something that's going to bring you joy and happiness. So take care, everybody. Bye-bye.
Thank you.
Thank you.